The government of St. Kitts and Nevis is not contemplating mandatory vaccination against the COVID-19 virus, according to former Health Minister Wendy Phipps. At a 6 October COVID-19 media briefing, the former Minister of Health said, given the high level of vaccination against COVID-19 in the Federation, there is no need to pursue a policy of mandatory vaccination.
It makes no sense to force a mandate, a vaccine mandate, on the population of a country with that type of high level of vaccinations. In all of the jurisdictions that we have noticed, including the United States of America, if I dare carry it outside of CARICOM, there have been vaccine mandates that were deemed necessary because of exceptionally high levels of vaccine hesitancy, outbreaks in the public, etc. How do we feel about vaccinations for special groups? Most definitely, the government is of the view that in the event of healthcare, in the case of healthcare workers, persons who teach other people's children, especially children below the age of 12, we would think that they will take the moral high ground and get themselves vaccinated because those children cannot protect themselves. If the day ever comes for us to reach the point of a vaccine mandate, it has to be backed by an abundance of irrefutable evidence that we had no other choice but to do so. But for the time being, there really is not a justifiable case that we can make to basically force people into taking a vaccine. For the time being, the approach that we are taking is that we do not see the need to have a mandate for vaccines at this point, given the privileged position that we are in terms of the high rates of vaccination.
According to the 6 October vaccination update, St. Kitts and Nevis stands at 76.4% of the target population having their first vaccine dose, while 68.9% are fully vaccinated. Glenn Barrett reporting for SKN Newsline.